Hi, my name is Dr. John Stevens from the Pain Recovery Center in Streetsboro, Ohio, proudly serving this community since 1995. We're located at 8961 State Route 14. We could be reached at 330-626-4300. We offer a full range of physical therapy, massage therapy, and chiropractic therapy. So lately, we've been getting a few patients that have come in with what's called plantar fasciitis, which is heel pain. Sometimes they'll get pain down the back of the leg through the Achilles or just at the bottom of the foot. And they state that this pain is horrible first thing in the morning or when they first get up out of a chair. And that's typically related to shortening of that muscle for any length of time. And then when they apply that pressure, it's just a burning feeling. Sometimes it'll feel like pins and needles. Sometimes it offers an inability to walk depending on how bad it's been. A lot of times they'll have gone to their podiatrist or their family doctor. They'll get injections in the foot itself, in the bottom of the foot, and they're really not getting much relief with that. I've been of the opinion for years now that this is more of a functional issue. It's related to tight calves for sure, and then those calf muscles go down to the bottom of the foot. They're called the plantar aspect of the foot. The fascia becomes inflamed, and it's called plantar fasciitis. With this, it's not a primary diagnosis. Plantar fasciitis is a result of several things. One of them being shortening of the calves, another one being a gait issue where you're walking more just because of your inability to dorsiflex the foot. You're walking like this and you're putting a lot of that pressure down below. So the typical using a frozen water bottle or using some type of roller, nubbed roller on the foot really doesn't cut it. It helps for a little while, but still the problems persist. People have worn what's called a Strasbourg sock. Again, it's helpful, but it doesn't cover 100% of what's wrong. I want to just show you guys this chart, which is from Travell and Simmons, which will show you the active trigger points of the calf, which refers pain down to the foot. Okay, so after you've looked at that chart, this is just an illustration and a guide of where you can mine these trigger points. Just try to poke around and find them. And once you get on one, you'll know you're on one. They'll probably feel about the size of a ping pong ball and just as hard. So people will try to just do some aggressive stretches, which here again is not a bad thing to do, but we think that it's more than just that. We think you have to really, just decrease those little knots in there, right, that are once again called trigger points that refer the pain down into the heel. So we get one of these balls here. This is called a yoga tune-up ball. You could actually get a really hard tennis ball from your local pet store, or once again, just look these up online. It's called a yoga tune-up ball. I wouldn't use a baseball or a softball. That's just a little too hard. And remember, we're not rolling. We're just mining these trigger points, and we're doing what's called ART, an active release technique, or SMR, self-myofascial release. So a real good one typically is right in this area here. There's a nice one for me. So what I'll typically do is just raise my leg, put that ball there, and I'll actually bring my foot forward to relax that muscle. And then once I find that and I'm right on one right there, I'll just start to move the foot, dorsi and plantar flex. Then after about 30-40 seconds, I'll feel that minimize a little bit. And then just to add even more pressure, I'll put the foot back down. I'll raise this leg on top, and then I really feel it there. So you have the liberty of moving your foot right there. I'm just right on that, and then I'll just work that probably for a couple minutes. So again, referring back to the chart, you'll see that there's trigger points up by the knee, on the outside of the calf. So you're looking at the tibialis posterior, you're looking at the gastroc, you're looking at the soleus. So any chart that you find that'll show you a trigger point here that refers pain through the calf and down to the bottom of the foot, which is called the plantar fascia, it is is great. Just really work those. And at first it's going to hurt, but then as you go along, you'll be sore but better. Once again, my name is Dr. John Stevens. We're at the Pain Recovery Center at Streetsboro, Ohio. We're talking today about the first phase of treating plantar fascia, chronic foot pain. We'd love to be of service with you if we could help. If this does not help alleviate your pain, please give us a call, 330-626-4300. We're located at 8961 State Route 14. Thank you.